10. The respiratory rate of 32, the pulse ox of 90 on room air, and coarse crackles in the lung bases.
Yeah.
Okay. So your rationale there is that infections can precipitate complications of sickle cell disease, and severe pain can signal a vaso-occlusive crisis. Normal vital signs for a 6-year-old are listed there. The child's temperature, blood pressure, and heart rate are within normal. The elevated respiratory rate and low pulse ox reading can indicate problems with perfusion or oxygenation. The breath sounds could indicate that infection or the possibility of acute chest syndrome developing. Your next one asks you to find, or click to find, to indicate if the finding is consistent with a pain crisis, acute chest syndrome, or a splenic sequestration, and that each finding may support more than one condition. So, history of recent respiratory illness could have fallen into any one of those. Pain only in the lower legs is just pain crisis, right? Pain in the legs is not going to signify that they have anything going on with the chest, okay, or the abdomen. Crackles in your lung bases are just for your acute chest syndrome. Respirations of 32 could go for all of them, right? So whether they're in respiratory distress or they're in pain or they have splenic sequestration, could they have an increased respiratory rate? Yeah. Their pulse ox of 90 on room air could go for any one of those. Your soft abdomen would be just your pain crisis and acute chest syndrome, because what would you feel with splenic sequestration? Rigidity, right? You're going to palpate that spleen, right? It's going to be large, it's going to be firm, okay? And then your blood pressure of 108/70 would be just your pain crisis or acute chest syndrome, okay? So, recent illness can cause the hemoglobin S inside the red blood cells to stick up or clump together, causing the cells to elongate and form a crescent or sickle cell shape. The sickled red blood cells can block the flow of blood and prevent oxygen from properly circulating. Tissue distal to the blockages become ischemic and result in pain. A pain crisis or vaso-occlusive crisis or episode can occur following a respiratory illness that lowers the oxygen level or dehydration. Acute chest syndrome is a complication that can follow a pain crisis if the sickle cells block blood and oxygen from reaching the lungs. The most common finding in ACS is fever. Other respiratory symptoms may include elevated respiratory rates, low pulse ox reading, and changes in breath sounds, chest pain, and cough. Splenic sequestration occurs when sickle cells get trapped and destroyed in the spleen. The spleen enlarges with blood and becomes swollen and painful, and manifests as symptoms of shock. Your next one, you are to drag the two most appropriate phrases from the choices to fill in the blank of the following sentence. The top two priorities of care for this client are, you should have providing pain management and beginning oxygen therapy.
Yeah.
Right?
Mm-hmm.
Okay. Your rationale there, the client most needs pain management, right? Their pain is pretty high, so we're going to manage that. And oxygen to stop the sickling process and treat a vaso-occlusive pain crisis. The client may also be developing acute chest syndrome, but further testing is indicated for that. Antibiotics may be needed if the diagnosis of acute chest syndrome is made. Labs indicate adequate hydration at this time. Interventions would be implemented to optimize hydration, but a fluid bolus should not be given until acute chest syndrome has been ruled out. Right? We don't want to add a whole bunch more fluid if circulation isn't getting to the lungs, right? While hematocrit and hemoglobin are low, the hemoglobin greater than 10 is within the target levels for children with sickle cell disease. A transfusion may be needed if the diagnosis of acute chest syndrome is confirmed or oxygen needs continue. So at that point, they would do like a transfusion exchange or an exchange transfusion where they take out the patient's blood and they replace it with something else, right? So get rid of the sickle cell and put in cells that are not, okay? Hemoglobin greater than 10 is really good in actually any of our like hematology oncology kids. We will not transfuse until they hit below 7, right? So 10 is actually pretty good. So Your next one was to select orders from the categories the nurse anticipates to place in the plan of care. Each category might have more than one. Right. Are you going to do the incentives barometer every hour while awake? Are you going to give oxygen? Yes. Are we going to add ice to the affected area? No. Never, ever, ever go anywhere near a sickle cell patient with ice. Right? Why would we never apply ice to a sickle cell patient? Because it constricts their vessels, right? They're already having an issue with their blood moving through their vessels, and then if you constrict it, could you potentially put them into a vaso-occlusive crisis? Yes. So never, ever, ever go anywhere near a sickle cell patient with ice. Okay. We don't need to do the fluid bolus, but we do need to do morphine. We don't need to do ampicillin right now. We should get a chest x-ray because we want to know, do they have something going on in the chest? And we want that reticulocyte count. Okay. So our oxygen therapy is needed to stop the sickling, and incentive spirometry is needed to prevent the acute chest syndrome. Heat can be used to manage pain, but ice packs can constrict the blood vessels and worsen circulatory systems or symptoms. Maintenance fluids are indicated, but a 20 ml per kilo fluid bolus could compromise their respiratory status. So they're not going to get a bolus, but we might just put them on their maintenance fluids. Okay. Right? So they are going to get some sort of hydration. They're just not, we're not going to throw a bolus at them. We're just going to hook them up to their maintenance fluids. Okay. Morphine is indicated to treat the pain. Ampicillin is contraindicated because the client is actually allergic to penicillin. Did you all pick up on that? Yeah. You forgot? Yeah. Right? So check their allergies, right? This patient was allergic to penicillin, so they are not going to get ampicillin. A chest x-ray is needed to rule out the acute chest syndrome, and a reticulocyte can help determine the need for a blood transfusion. A blood gas is not needed unless the client does not improve with that oxygen therapy. And then you are to highlight the orders that the nurse would implement immediately. So you should have selected the 5% dextrose and 0.5 normal saline at 65 an hour. So that is their maintenance, right? And you will find that for our kiddos who are admitted, the most common fluid that you're gonna see is D5 half NS, right? So 5% dextrose and then 0.45 normal saline at their maintenance rate. You're also going to put oxygen on them, and you're going to give that morphine.
Are you talking about for heme?
Just kids in general. Kids in general, their normal fluid is 5% dextrose and half normal saline. Okay. So your priorities should be to provide oxygen, give them morphine to decrease metabolic needs, and stop the sickling process. Morphine is ordered IV, therefore an IV must be placed to give the medication. A chest x-ray should be obtained to rule out the life-threatening problem of acute chest syndrome, but this should happen only after measures have been taken to reduce the sickling. So after you've given the morphine and the fluids and oxygen, should you then look at that x-ray. The reticulocyte count is needed to determine if a transfusion is needed, but obtaining this lab can happen after the oxygen and the morphine. A PCA would not be started until after the morphine is given. Incentive spirometry can begin after pain control measures have begun to take effect, and transferring to the Peds unit depending on if a bed is ready and available. Okay. And that incentive spirometry, the piece about it beginning after the pain control, that is, are they ready to learn and are they ready to do something? If they're in a lot of pain, are they going to want to do their incentive spirometry? No. Right? Get them under control, right? And then you can start doing those other things that you're going to need them to do, right? But until you do the things that you need to do to get them comfortable, they're not going to want to do their things yet, okay? And then your last question there was to click to indicate whether they have improved, worsened, or not changed. So your leg pain got better, your respiratory status got worse, your blood pressure was not changed, your back pain got worse, and the temperature got worse. So your leg pain decreased, indicating perfusion is most likely improving to the lower extremities, but the new back pain could indicate the involvement of other organs, including chest syndrome, acute chest syndrome. The client was started on oxygen, the finding that the tachypnea and the pulse ox readings have remained the same despite the oxygen indicate that their status is declining, right? So all of those two findings should have improved with you giving them oxygen, right? But it didn't. So therefore it declined. The client is now presenting with a low-grade fever, which could indicate pneumonia or acute chest syndrome, and the client's blood pressure remained stable. And then your bow tie, you should have selected. The condition that they have is a pain crisis, so you're gonna give them morphine and begin oxygen therapy, and you're gonna monitor their pain level and oxygen saturation. Cool. So the history of the labs and the pain characteristics in the lower legs suggest that the client is most likely experiencing a vaso-occlusive crisis. Acute chest syndrome typically would include other respiratory findings such as chest pain, breath sound changes, or cough. Aplastic anemia presents as severe anemia. A sequestrant crisis manifests as abdominal pain and symptoms of shock. The client most needs IV morphine and oxygen to decrease the metabolic demands and stop the sickling process. IV fluids may be needed, but the lab's vital signs do not indicate a fluid deficit warranting that bolus. Antibiotics are not yet indicated as the child is afebrile with a normal white count. Hemoglobin levels are within the target range for the child with sickle cell disease, and a transfusion may be indicated but is not needed. Stat. The interventions are targeted at reducing pain and improving oxygenation. Those best to monitor for the effectiveness of treatments. Cool? Feel pretty good with that?
Yeah.
I think you can manage a sickle cell patient next week in sim? This week in sim?
Yeah. Or
Sure,
just
absolutely.
switch up
You got
the
this.
arrangement.
You got
Do
this.
it. Rest.
Cool.